2023 Board of Douglas County Commissioners 5:30 business meeting. We want to welcome those of you who are here with us at the old courthouse and also those joining us online. Some of you may be here to provide public comment. The Board of Douglas County Commissioners welcomes public comment and in advance thanks you for following these procedures. Each action item on the agenda will offer an opportunity for relevant public comment about that topic. We ask that you wait until the agenda item you're here for comes up for discussion. Comments relating to agenda items are welcome after the board has had an opportunity to discuss the topic. The Board of County Commissioners will invite comments on topics not on the agenda during general public comment directly after considering the consent agenda. This is a time for addressing issues not on today's agenda, but related to the general business of the Douglas County Commission. We'll first call on folks who are here in person, and then we'll turn to any online commenters who are with us tonight. If you're here on Zoom, please plan to use the raise your hand function when the time comes and listen for staff to call your name. All comments will be limited to 3 minutes. We ask everyone to give their full name and Douglas County residence for our meeting minutes. All public comments should be directed to the County Commission. Campaigning for public office is not allowed. We also reserve the right to mute or remove any speaker who is vulgar, rude, or inappropriate. The public should also know that the comments received by this commission during our meetings do not represent the views of Douglas County government. If visual aids are used during the meeting, the presenter will share their screen. Please know that online participants will not be able to view them without a computer, smartphone, or tablet during tonight's meeting. Materials are published online for your reference as well. Lastly, a recording of this meeting will be available on our YouTube page and website. Tonight's meeting, we're going to start with a proclamation, and then we have 2 items on our consent agenda before general public comment. We have a number of items on our regular agenda. We'll do a public hearing. We'll close the public hearing on Consolidated Fire District 1. We'll have a behavioral health projects update on familiar faces in the Harvard Kennedy School of Government Performance Lab. There's a request for one-time funds from the behavioral sales tax for the purchase of land for permanent supportive housing from Bert Nash. We have a resolution to support the county commissioners, Douglas County, to submit a application for home ARP funding for the Kansas Housing Resource Corporation. Then we have 2 planning items. One is a special events permit and then a TBU. We'll finish up with appointments, Commissioner Administrator miscellaneous before we adjourn. Commissioners, let's start with the proclamation. I'll go ahead and read that. Whereas this is for Suicide Prevention Month for September 2023. Whereas in the United States, 1 person dies by suicide every 11.1 minutes. In Kansas alone, 1 person dies by suicide every 16 hours. Whereas in 2021, 55 Kansans died of suicide, leaving thousands of friends, family members, and loved ones changed forever by their loss. Whereas suicide is the 2nd leading cause of death for Kansans aged 15 to 34, and the 9th leading cause of death for people of all ages in the state. Whereas the Kansas Suicide Prevention Headquarters is committed to providing support, education, and crisis services for all of Kansas with the goal of preventing suicide and saving lives. KSPHQ bolsters this mission through a series of comprehensive services, including the local crisis phone line, the 988 National Suicide and Crisis Lifeline, online chat counseling, text chat counseling, ongoing private therapy, school community crisis response, suicide prevention and awareness training, and school-based prevention. Whereas KSPHQ is dedicated to reducing the frequency of suicide attempts and deaths through training, educational programs, and outreach. We urge all Douglas County residents to 1, recognize suicide as a significant public health problem in Kansas and Douglas County, and declare suicide prevention a priority. 2, support the development of accessible mental health services for all Douglas County residents. And 3, encourage initiatives based on the goals and activities contained within the Kansas State Suicide Prevention Plan 2021 through 2025, the National Strategy for Suicide Prevention, Zero Suicide of the National Action Alliance for Suicide Prevention, and the Way Forward by the Action Alliance Suicide Attempt Survivor Task Force. Whereas far too many residents of Douglas County and Kansas suffer alone through mental health crises or suicidal thoughts. Therefore, be it resolved that the Board of Douglas County Commissioners do hereby designate September 2023 as Suicide Prevention Month and urge Lawrence and Douglas County residents to learn how they can help because it takes all of us to care for each of us. Adopted this 6th day of September 2023. I believe Steve DeVore here is to make a few comments.
Well, good evening, commissioners and staff. I'm Steve DeVore, President and CEO of Kansas Suicide Prevention HQ. And on behalf of our organization, I want to say thank you for that proclamation this evening. I want to go through just a couple of statistics and put into context why this month and this message is so important. As the proclamation stated, there were 555 confirmed suicides in Kansas last year alone. It's estimated that for every suicide, there are 20 attempts. So that puts it over 11,100 attempts in the state of Kansas alone. That's if every man, woman, and child in Eudora and Baldwin collectively attempted suicide last year. So that's why it is such an enormous problem. But what are we doing to be able to help fix this problem? Last year alone, through 988 and through our local hotline, we answered over 28,900 phone calls just from individuals in the state of Kansas. From Douglas County alone, we had 3,612. So that's about 10 a day just from Douglas County on calling our hotline and needing some help. So this is a problem that we're all in this together for. Tonight, this proclamation serves more than just a piece of paper hanging on our office wall. It serves as a reason for us to be able to start and have good, productive, influential conversations with our community and within our friends and our neighbors and our families. This is a topic that's going to take all of us to be able to overcome, and the proclamation this evening is going to allow us to have those conversations. We are so fortunate to be in Douglas County. You're going to hear this evening from some other speakers about how our entire system works. We are so blessed to be able to have a city and a county that is focused on mental health, that's focused on how do we help our residents. And this 988, ourselves, along with the city and the county and Burt Nash and a lot of our other partners, working together to help every single resident every single day. So thank you for this proclamation this evening. We greatly appreciate it. And thank you to all of our partners that help us in this fight. Thank you.
Okay, we'll move on to our consent agenda. Commissioners, is there any item you'd like to have pulled from the consent agenda for further discussion? Seeing none, any member of the public here or online have an item they'd like pulled from the consent agenda? Okay, seeing none, I'd take a motion on the consent agenda.
Commissioner Reed move to approve items 2.1 and 2.2.
Second.
Moved and seconded. All those in favor say aye.
Aye.
Passes 3-0. We'll move on to general public comment. Is there anyone here to provide general public comment for items not on today's agenda? You're welcome to come forward and provide your comments.
My name is Dr. Justin Spees. There's still a lot of talk in the media about COVID mandates coming back. And so here's my weekly reminder to you guys to not bring the mask mandates back. And I want to read from an article as for one of the reasons not to bring these masks back. Now, keep in mind, this is in addition to we're Americans and we don't need you telling us what to do. This is in addition to the fact that masks don't work. This is in addition to what I came in and read last week to you guys about how it's affecting emotional development in adults and children. This is in addition to masks impacting communication, increasing anxiety, and increasing cognitive problems with children. So this article was recently published in May of 2022 in the journal Environmental Research. It's called Carbon Dioxide Rises Beyond Acceptable Safety Levels in Children Under Nose and Mouth Covering, Results of an Experimental Measurement Study in Healthy Children. We wanted to determine the average CO2 levels in inhaled air with masks in children between age 6 and 17. We use short-term measurements under surgical masks and FFP2 masks compared to baseline. We measured breathing frequency and pulse as potential physiological moderator variables in 45 children, 25 boys, 20 girls with a mean age of 10.7 years. Appropriate contrast revealed that the change between baseline and masking was due to the masks only, and the difference between the two types of masks was small and not significant. Wearing of NMC surgical masks or FFP2 masks raises CO2 content in inhaled air quickly to a very high level in healthy children in a seated resting position that might be hazardous to children's health. Even under conditions of sitting still for approximately 18 minutes with masks, we measured strong increases in the carbon dioxide of the inhaled air under the face mask. The increases were numerically large and statistically highly significant. The results were very robust. Thus, carbon dioxide is accumulated in the mask and is inhaled back. This increases carbon dioxide in inhaled air under mask to levels that violate accepted safety norms for carbon dioxide. We were clearly able to distinguish between carbon dioxide content in inhaled air and exhaled air, and in the joint inhaled and exhaled air, which speaks to the validity of our results. These findings support the potential causal link between symptoms such as headaches and fatigue and raised carbon dioxide content in inhaled air under masks. And I just want to end with a quote here from UC Berkeley statistician Benjamin Reck, who says, "At this point, I doubt any study will change anyone's mind about masking, but the one consistent finding of all the randomized studies is that the effect of this intervention at the population level is vanishingly small."
Any other public comment?
Good evening. My name is Brent Bovee. I made comments last week during the budget hearing and was wondering if you could tell me why the document supporting the budget that was approved totaled 183.8 million rather than the 190.7. And if you could provide us with a reconciling statement of that. And I've also prepared 5.5 pages of questions and information requests, and just like to suggest to the commissioners and the administrator that you hold a public forum so we could hear the answers to these questions. And I'm happy to get you a copy. Thank you.
Any other public comment?
Good evening, Dr. Erica Anderson. I attended your working session around homelessness and housing. I want to say thank you. I really appreciate the information that was presented, but I also appreciated the conversation that you all had. There were a couple of things that I noted, and if this has already been done, then I would just appreciate, because I could not find the information online. But I would encourage this commission and the work group as well to ensure that there is a landscape analysis based on all of the funding that currently exists in Douglas County that can be leveraged for all of this work. To include, as you mentioned, taking a look at national, but also state level opportunities that all of the funded partners can take a look at for the years that will be forthcoming to fund all of these initiatives. Also a gap analysis on all of the services that are currently being utilized, but all of the services that are also currently being delivered and possibly not utilized. Also a gap analysis on the funding, what is not being funded that should be funded, and then an analysis on the funding that should be then gone after, for whether it be grants or even for-profit organizations that are willing to give the money to this particular initiative. And then also a gap analysis on your population. I heard a couple of things. First off being that there is a priority population, our senior population, but at the same time, I also heard that that was not necessarily a focus of the assessment, because the assessment focus was really focused on the chronically, those that are chronically homeless. So really taking a look at that gap analysis and seeing really where those priorities lie in order to really develop that action plan and those next steps, I think should really be an important part of this work moving forward. And then also that overlap of who is really funding what at the local level, and then who's funding what at the state level as well. So once again, what can be leveraged so that we ensure that all these collective partners, as they're coming together, that everyone is working together. And then lastly, also, I noted that some of the families are like moving into maybe transitional housing. And so what can we do to ensure that they stay in the housing that they have or the rental situations that they have? So can we work with lenders? Can we work with landlords to ensure that they stay in their homes versus moving them into some sort of a transitional home? I think that that would be a great opportunity as well. So thank you for your time.
Any other public comment? Anyone online, Sarah?
We're gonna try to get Sherilyn in. She's raised her hand, but. Okay. Sherilyn, you need to, you can come off mute. You have 3 minutes to provide your public comment.
Oh, I'm concerned about the reaction that the general public is having to the situation, and I really kind of don't blame them. See, the situation down by the library has gotten out of control. There's some out of control behavior down there, and some people really don't want to take their children down there. People will stand around engaging in language that really shouldn't happen. And this hanging around down by the library, I think, is really not popular. I've also heard that homeless people have actually walked into people's houses, maybe asking for a drink of water or going up on people's porches and, in rainstorms and asking for some kind of help. I mean, you're losing the public's desire to help when this kind of thing goes on. I would also like to say something which I maybe mentioned before. I was volunteering at this little peer group, and I know you're trying to make a comprehensive system, but one of the homeless outreach workers came over there and dropped somebody off. There was no plan whatsoever for this person. And I found out this person was addicted to meth and had been violent or abusive with their own family, and that's why they were roaming around homeless. And I called over to Bert Nash and I said, I don't think this is a really good idea. And she said, well, aren't you open to everybody? And I feel like saying Bert Nash has millions of dollars, city, county, state, federal funding, and backing of, businesses here. We're just this tiny little organization. And in my experience, not always, with Bert Nash, is that they would find somebody they didn't know what to do with, and they would sort of toss them our direction. And then subsequently, sometimes when we would try to help some of the people that they couldn't or wouldn't help, I felt like they didn't like that either, because because some of the people didn't fit in their system so easily. I mean, this goes on for long ways. And I honestly felt like Bert Nash, to me, has not especially valued the peer movement outside of them. And I've said this before, I've never understood exactly why. And it bothers me a lot. But I just don't think, having highly drug addicted or alcohol addicted sort of pushed over to some little peer group and then just expecting us to do something that we're not really capable of doing is not a good idea. Thank you.
Any other public comment? Okay, we'll close public comment. Typically, we don't answer comments from we can choose, but we may direct staff. Sarah, I want to give you an opportunity to address Mr. Vaubay's question about the differences and what's posted. Do you have anything on that?
I don't have the state budget forms pulled up, but I would say that the state budget forms are largely about property tax and ad valorem. But our total budget is inclusive of other funds and reserves, also our reserves as well. So that's oftentimes the discrepancy, but I can try to pull up last week's agenda and ask that question. And I'd be glad to have Mr. Bovee send me his list of questions. I'd be glad to take a look at them.
Thanks. Okay, we'll move on to our regular agenda items. First is to conduct a public hearing to receive public comment on the Consolidated Fire District Number 1, 2024 budget and conduct a roll call vote to pass a resolution to exceed the revenue neutral rate. We did open this public hearing at our last meeting, so the hearing is still open. Commissioners, do you have any questions beyond what we asked last week?
No, I've had all my questions answered.
I don't have any questions either. We'll take any public comment on this item. Anyone here to provide public comment?
Brent Bovee, rural Douglas County. Have a few questions to ask before the vote. How do you arrive at the property tax amount related to Consolidated Fire District Number 1? Isn't it true you back into or solve for the property tax for any funds that attract a tax levy? The form on page 7 of 15 in tonight's budget hearing packet appears to indicate just that. To put it another way, is it true during your budget process for both CFD 1 and the overall operating budget for Douglas County that you approved last week that you roll up the expenditures for all funds that attract a tax levy and then compare that expenditure amount to the total receipts budgeted? And is it true the difference between those amounts is the tax required to be billed to the taxpayers in our county? The shortfall in the receipts compared to your budget expenditures must be the property tax. Is that correct? Receipts for CFD number 1 before property tax is calculated at only 86,000. Property tax required per the calculation on page 7 is 1.6 million. Property taxes for the last 3 years, also on page 7, indicate 22 was 1,111,000, 1,222,000 in 23, 1,602,000 in 24. This is an increase of over 31% on top of last year's increase of 10% just for CFD number 1. But as everyone in the room knows, the city and the school board are increasing property taxes on citizens too. And then there's last week's county budget where the property tax increased by over 6% year over year and by more than 28% since 2021. These tax increases are not sustainable. Does the operating budget process for the county include a review for each department, including areas where costs can be eliminated or deferred? Do you review the headcount by department to ensure headcount remains flat? Do you review any excessive sandbagging in the budget process? Or put another way, are budgeted amounts all across departments continually higher than actual spend? If the budget is inflated, then the property tax solved for in CFD number 1 fund is also inflated. And that means we all pay the price, just like we all expressed last week. Thank you.
Any other public comment? Anyone online? Okay, we'll close public comment. Commissioners, any further discussion? Going to make a motion to adopt the 2024 Consolidated Fire District Number 1 budget. We'll take a roll call vote to pass resolution 2328 delivery property tax rate for the 2024 Consolidated Fire District Number 1 exceeding the revenue neutral rate.
And
moved and seconded. Sarah, you want to call the roll?
yes, Commissioner Kelly,
Yes.
Commissioner Willie,
Yes.
Commissioner Reed,
Yes.
vote passes 3-0.
Thank you. All right, we'll move on to our second item, which is a behavioral health projects update on the Familiar Faces Initiative and the Harvard Kennedy School of Government Performance Lab. And Bob Tryansky is here. Hi, Bob.
Hello, commissioners. bear with me for 1 second. Good evening, Commissioners, and we are very excited to have an opportunity to share a couple of things this evening that I would group all within the realm of a behavioral health projects update. The first is a new resource that is available at the county website. If you go to the county's homepage, which I've pulled up here, you'll notice that there's a new report that's available to the public that highlights our collaborative efforts to improve and expand behavioral health care in Douglas County. Our partners have worked together on this report. It's a digital report. It's a report that allows people to navigate and move through information that they are particularly interested in. It's not a website per se, but what it is, it's an attempt to summarize the various initiatives and projects. And so I wanted to give you an opportunity to see this and then wanted to highlight some of the features of this report. You'll notice in the middle here, this challenge, response, and impact. And if you pull that up, it takes you to a menu. And I like to think of this as a window into all of the various initiatives that have been initiated, implemented, funded, supported over the last 6 years since we really started working together to try to build an integrated system of care that goes from crisis and illness to recovery and prevention. As you know, in the Community Health Improvement Plan, the Behavioral Health Plank identifies 3 focus areas: prioritizing prevention, promoting integration across the system of care, and improving access to care. Each of the initiatives that's been launched over the last couple of years is cross-referenced on this page. And so let's say that you, for example, you're interested in learning more about the prevention initiatives. You click on the prevention tab and you could, for example, pull up information about our prevention coalition that's been led and shepherded by DECA over the last couple of years. It's called Engage Douglas County, and their focus is engaged adults and thriving youth. Each of the tabs has a number of links. So for example, here you could go and learn specifically from the Engage Douglas County website, all of the different initiatives that have been launched by young people, by DECA, by all the participants in that coalition, our school districts, the number of nonprofit organizations to prioritize prevention, to get resources into the hands of parents and young people so they're prepared to make good choices and they're prepared to make informed choices. The report also, let's show you how to navigate here. Of a walk and chew gum at the same time challenge sometimes. One of the things we brought in line, one of the resources is My Strength. A person can access information about My Strength and sign up straight from the digital report. When they choose to sign up, the form populates the access code. So really all you have to do is provide your email address and you can very simply access that resource and that tool. So all of the prevention initiatives are summarized on the report. And I'm going to ask, and one of our prevention priorities is to reduce and prevent suicides in Douglas County. I want to thank the work that was done by Lawrence Douglas County Public Health. I'm going to ask Dr. Dee Kynard to come up from Lawrence Douglas County Public Health. Dr. Kynard is the interim director of informatics for the health department. She worked in conjunction with our senior data analyst, Dr. Matthew Cravens, on kind of summarizing and checking the data that was submitted by our partners. Their work in the suicide space is one of those pieces of work that, it overlaps into 2 realms. So some of it is prevention work and some of it is integration work. So I'm going to turn the microphone over to Dr. Kynard and she can share some of the work that's being done with Zero Suicide since we are in Suicide Prevention Month.
Good evening and thank you. So Striving for Zero Suicide is a module under, as Bob said, the prevention and integration sections of the behavioral health report. And it highlights, as you know, a very important public health issue and prevention strategy that's also in the community health plan. So suicide, as you know, has consistently been in the top 10 causes of death for people in Douglas County of all ages. And for people 15 to 44, it's the second cause of death in Douglas County. We also have a significant number of people in Douglas County who are at risk for suicide. For example, since 2018, more 10 to 19-year-olds are treated in the emergency department for suicide attempts than any other age group. And those in their 20s are the second most common age group treated in the emergency department for suicide attempts. Many at-risk people, regardless of their age, touch the healthcare system a year before their death by suicide. So clearly, the healthcare system has a very important role in prevention of suicide. So what Zero Suicide does is it provides the framework for safer suicide care. And if Zero Suicide is implemented to fidelity, we can prevent suicides. What's exciting in Douglas County is we have a countywide suicide prevention network that is implementing Zero Suicide with 6 healthcare agencies participating. And what I've learned is, and KSPSQ has done a wonderful job training and supporting all the agencies in implementing Zero Suicide. So the potential is here to prevent a lot of suicides. So what I've learned from the health department is that Zero Suicide has helped our staff feel confident in asking the screening questions for suicide. And because the care pathway actually defines what to do and how to do it for all the high-risk patients. And this care pathway is not only supportive for those who are in crisis and in need of care, but it's also helpful to the staff because it does provide that map for what they need to do. And I've had multiple staff come to me afterwards and say it's not only helped them in their work to help folks better, but it's helped them in their own personal life to help those outside of work. So there's more information about Zero Suicide in the report, and I would urge you to peek at it. But just know that your support has made a difference. Thank you.
Thank you, Dee. Also in the integration space, a new plank or a new objective that was added last year, as Jill shared during the work session, is to increase supportive housing. And so, a quick summary of some of the progress that's been made in the supportive housing space. The fact that we've added 43 units of supportive housing over the last couple of years with the work that was done at the recovery campus with the tenants to homeowners, the Sunrise House project with transitions, 43 units. It's a start. It's inadequate. It's less worser. It needs to be more better. But again, the report allows the public to kind of see where that progress is. It also links to things like the needs assessment that was done by the Corporation for Supportive Housing. So if members of the public want to access that report, it's very easy to access those resources right from the interface of the report. So I just wanted to let people know that that is available. Like I said, it's an opportunity to look through the multiple panes of the window and a window into the changes that are happening in Douglas County because of the collaboration of partners, because of the community's investment and support, and because of public leadership, publicly elected officials and their commitment to making progress in this area. Second thing I want to share with you is some information that we shared last night with the City Commission. And give me 1 second as I talk to myself, as I do in situations such as this, so I don't make mistakes. To start the slideshow and share the screen. No. Fingers crossed. Not gonna work. I may drive this from the side. Sorry, folks. The three dots here. Bottom of the slide. Thank you. Thank you, Sarah. Screen or the screen? Sorry, everybody. There we go. Thank you, Eric. Okay. We are entering a new season in our work together. And this isn't working either. And that work, if you looked at Douglas County in 2018, when a person was in crisis, they had limited options, and those limited options resulted in people often going to a less than desirable place to get their crisis solved and resolved. That's caused by the fact that before we started working together and bringing resources online, a person in crisis would typically call 911 when they're experiencing a behavioral health crisis. Police or a paramedic would be dispatched, and the police and the paramedic would transport the person to the emergency department or to jail, especially if it was after hours. What's happened and changed, and that results in a revolving door where people go in and out of emergency departments and they go in and out of jail too frequently. This is not a new story. What is new is over the last 5 years and really over the last 18 months, we have brought on those core components of an ideal 24/7 crisis response system. That includes a 911 includes an air traffic control system that's available 24/7 through a crisis line where a person can call 911 or 988. And instead of dispatching police, if police are not required, if an ambulance is not required, that call 80% of the time ought to be able to be resolved on the phone. And our friends at headquarters have shared with us the progress that they've been made. As we look at the data, 80% of those calls are being resolved on the phone. If the call can't be resolved on the phone, then 988 can dispatch and deploy mobile crisis teams. And the mobile team at Burt Nash came online in September, almost a year ago, September 11th, and is available from 8 a.m. to 2 a.m., 7 days a week. 70% of those calls ought to be resolved in the field. If those calls can't be resolved in the field, the mobile team can transport somebody to the treatment and recovery center. The treatment and recovery center works with them and is available 24/7. The person can walk into the treatment and recovery center between the hours of 8 and 8 Monday through Friday, between 12 and 4 on Saturday and Sunday. And then the last piece of the puzzle is those post-crisis supports. So this is a massive improvement for the person in crisis because we've invested in bringing online these core components of an ideal crisis system. But that system is complex. And so the work that is challenging us now is to figure out how do we align all of the various services, both those that existed prior to these new components being brought online. How do we align those and how do we optimize them so people get the right response in the right location at the right time? And we shared this before, but I just wanted to go back over. These are the types of complexity and system challenges that you face as you try to integrate care in an ideal crisis system. How do you build and sustain a 24/7, 365 crisis system in a community of our size in a state without Medicaid expansion? How do we ensure that individuals in crisis receive the right care in the right setting at the right time? And what that means is, how do we ensure that they receive that care every time? How do we maximize outside funding sources and foster transparency, accountability, and continuous quality improvement while minimizing competition between agencies? How do we hold coalitions and emerging partnerships together and ensure fiscal discipline and accountability as we move from where we are now to where we want to be 5 years from now? And then the big question is, how should county government effectively leverage its position as a convener, strategist, and funder to pull together behavioral health, justice system, and community stakeholders to formalize a crisis system oversight that, that involves county and municipal government, healthcare and human services providers, EMS, law enforcement, criminal justice partners, citizens with lived experience, community stakeholders. This is a complex challenge that we're now going to face in the season is how do we bring these pieces together to make things smooth, efficient, and as effective as possible. We want to share with you tonight are two ways in which our partners are collaborating to do this. And the first is through something called the Familiar Faces Initiative. Douglas County has been involved in what is now called the Familiar Faces Initiative since 2017. It was originally called the Data Driven Justice Initiative. In 2017, a group of our partners, Patrick Schmitz was part of that, Karen Shumay from LMH, Sandra Dixon from DECA at the time. There were a group of us, the Sheriff's Department, Lawrence Police Department. We went to Washington, D.C. to talk about how you share data in order to be able to find individuals who are being failed by the system and bring better, more intentional, more robust resources to bear to help them solve their problems. This is, and one of the outcomes of that was that Douglas County made a commitment to bring My Resource Connection, MyRC, online. MyRC has become a data repository for the partners that are participating in behavioral health to be able to, again, share data and gather data so that we can see the comprehensive ways in which people are touching the system. Over the last year, Commissioner Reed and I have attended a number of learning communities in different communities around the country. And a lot of what we have been doing, both in those site visits and also in technical assistance calls through the National Association of Counties, is to figure out how we can hone and refine our use of MyRC, how we can ask and task our partners to ask their frontline workers to utilize MyRC more regularly than they have to this point, and how we can coordinate care through the information that we can share with MyRC. I'm going to ask Chief Lockhart to come up because about, what has it been now, about 4 months ago, Chief? Chief Lockhart shared that at LPD, there was opportunity to bring some of the information that was not in MyRC, which is police calls, together with the information that we have through MyRC, and to start to work together as a collaborative table, a new collaborative table, to try to meet the needs of people who continue to be failed by the system because we don't necessarily know where they are. So Chief, you want to share a little bit about that?
Good evening, Commissioners. Rich Lockhart, your Lawrence Police Chief. We were encountering the same people over and over. And one of the things that I talk about is, as police, we have one tool. That's arrest. And arrest isn't effective for people who are in crisis. It's not appropriate to criminalize people who are experiencing mental health or substance use. So one of the things that we did is we went to Bob and started working with this group, and we started having these Familiar Faces huddles where we talk about the people who are high users of police service, of fire service, of county services, and trying to figure out how do we focus our efforts on a smaller group of people to be able to have a positive outcome for them. So we're kind of shooting in the dark at this wide swath of things, but putting a bunch of people together, great minds, all people doing great work, will allow us, we hope, to be able to impact a smaller group of people in a significant way to reduce their impact on the system. None of these folks wakes up every day and says, gee, I want to get the police called on me today. None of them are waking up every day saying, I want to get an ambulance call and a ride to the hospital. They aren't in a place where they can get the service they need. So we're hoping through this initiative and the cooperative efforts of all the people you see on the board that we're going to have some positive outcomes for those high users of service. We've already seen some positive steps. We've had a couple of huddles and where we've talked about individual people. And for me, I left there with such an amazing feeling about the course we charted for the people we were talking about. We've been able to overcome barriers with HIPAA. We've been able to overcome other barriers with confidentiality so that we can all share the information. And what we're finding is all of us have pieces of the puzzle. And when they're all together, they make more sense. And so I think you're really going to see some great work from us in this space as we move forward.
Questions on that? I am not having a good technology day.
I'll ask a question
yes.
since you paused a minute. What's the dollar value you can put on roughly an ER visit, an ED visit, or a trip to jail? Like if reducing one of those, what's the dollar cost? I know there's a human cost also, but I'm just wanting to kind of see that out.
So for an officer to respond to a call, you're talking, thousands of dollars in training equipment, salary, just to get to that call. And then once we take them to jail, it's $250 a day to house them there. So again, not a very efficient use of our resources for someone who shouldn't be there in the first place. And ED visits, I don't know if you have that. Go ahead, Bob.
Yeah, I think the ED visits run between, depending on the emergency department and the number of services that a person, it's kind of a $1,200 to $2,500 bill. And, we have, I've said this over and over again with our familiar faces, we have, and Dr. Keinert's helped to elevate this, about 120 people who are responsible for over 700 visits at the emergency department a year. What we're looking at with this familiar faces, with these huddles, is we're looking at our lists of high utilizers and sort of quantifying how many emergency EMS runs are happening, how many calls for service with police, how many times a person shows up in the emergency department, and the work that Dr. Cravens has done to kind of synthesize through the database, through an algorithm, and kind of elevate people who might need more attention. You can't just automate this. I think that's one of the things that we've learned in the last 6 months. There are things we could do through an algorithm to help us whittle down and hone and focus a little bit differently, but the human element is what's really important. Leadership in each of these various parts of the system who can bring their expertise to the table and figure out how we can wrap around an individual and do that in a way that is preserving that person's right to self-determination. One of the things I think we've learned is that if we outreach people who are really struggling and ask them if they would be willing to share information so that we could get better results for them, our early experience is that people say yes to that. So that's kind of exciting. So this Familiar Faces initiative is an example of a real new local attempt to wrap around those individuals that are really struggling because the system has failed them for too long, and we have opportunities to do better as we should. The second piece is, as we move into deploying 988 and mobile teams, using 988 to deploy mobile teams as an alternative to 911 and emergency response by law enforcement and EMS, there's a lot of complexity there as well. And so I'm going to, again, turn it back to the chief to share some work that was done by the city of Lawrence to reach out and apply for an opportunity with the Harvard Kennedy School of Government.
So a few months ago, I received an email asking for solicitations to be part of the government performance lab at the Harvard Kennedy School. We had about a week to put it together. And so I made phone calls to Patrick, to Stephen, Chief Llewellyn, Bob, and I said, hey, can we do this? And every single person said, yes, what do you need? So we were able to assemble our application package within a week. It was a competitive selection process, and we were one of 14 cohorts selected throughout the nation. And so I want to introduce to you Ian Mai, who is our government fellow with the Government Performance Lab, and also Anna Obieri, who is the Director of Criminal Justice. And they're going to talk about how awesome this program is and what a great opportunity this is for not only Lawrence, but Douglas County, and how we're going to be able to make a huge impact on people's lives. So I'll turn it over to Ian and Anna.
Thank you so much, Chief. And thank you all for the opportunity to speak with the Douglas County Commission today. As the Chief said, my name is Anna Obiora, and I'm the Director of Criminal Justice at the Harvard Kennedy School's Government Performance Lab. By way of quick introduction, my professional background is in local government and justice reform. I used to work for the Department of Corrections in New York City, running job training and reentry programs for young people being released from the jails. I now oversee at the Government Performance Lab our work to support governments across the country as they develop alternatives to formal criminal justice system involvement. I will hand to Ian to introduce herself briefly.
Hi, good evening, everybody. So my name is Ian Mai. I am a Government Innovation Fellow here at the Government Performance Lab, and I have the honor of leading the collaboration with Lawrence and Douglas County this year. I will be working exclusively with Lawrence and Sacramento, so that's where my focus is going to be. And just a brief background for myself, I am an attorney. I have spent pretty much my whole career working on criminal system issues, first in the trenches as a public defender in Miami, and then transitioning over to sort of larger systems level change work around the country, where I worked with elected officials and grassroots groups to fund and pass legislation for incredible programs like the ones that y'all have in Douglas County that are really focusing on bringing their community services in order to divert them from jails and emergency rooms.
Thanks, Ian. So what we wanted to do today is just briefly explain a little bit about the Government Performance Lab and what we're here to do in support of the county and Lawrence. So our organization, the Government Performance Lab, or the GPL as we call it, is an applied research and technical assistance organization that is based out of the Harvard Kennedy School. But our mission and our model is that we send out staff to support local governments across the country to build just and effective systems. And over the past 3 years, our team at the GPL has developed what we're calling an alternative 911 emergency response initiative. And that involves providing support to jurisdictions launching or expanding the use of unarmed emergency response teams that can be directly dispatched to 911 calls, as the chief explained. So our technical assistance for this work is philanthropically funded and at no cost to the city or county. We're excited that Lawrence and Douglas County applied as part of our work and will be joining the Alternative 911 Emergency Response cohort this year. After a competitive process, Lawrence and Douglas County was selected to receive support from Ian and from our organization, specifically as one of 14 jurisdictions participating in the cohort. You all will be receiving technical assistance and coaching in an individualized way, depending on the needs of your program. This also involves access to learnings from other jurisdictions across the country that we're supporting, including Madison-Dane County, Wisconsin, St. Paul, Minnesota, where we're currently working to support their alternative response initiatives. And I just wanted to note that we were really drawn to the application that the chiefs and others submitted because of Lawrence and Douglas County's success in quickly developing a comprehensive alternative crisis response system and your commitment to intergovernmental collaboration to serve the residents of Lawrence and Douglas County. So we're really excited about this opportunity to offer support as the system matures and expands. I'll hand it back to Ian to speak a little bit more about the specific collaboration.
Yeah, so I'll speak quickly about the work kind of that we've already done with Lawrence and Douglas County and where we're headed. So we launched our coaching to Lawrence in the county about 2 months ago, and we've been working very closely and collaboratively with the chiefs and the other safe and secure partners, so representatives from behavioral health agencies and emergency communications, in order to identify the highest impact ways that we can support your alternative response system. And moving forward, we're going to be continuing that work, and specifically for the next couple of months, focusing really heavily on supporting emergency communications. And I just want to note that throughout this work, we are keeping this sort of North Star, this guiding principle that y'all have developed of providing every person in crisis the right response in the right setting every time. And I just want to say in closing that the opportunity to work with Lawrence and Douglas County really is a true privilege. I am so excited to be working in a jurisdiction that really demonstrates how much you can get done when different agencies and different governments are really working closely together to serve the needs of their residents. So we are very much looking forward to continuing work with the chiefs, with Bob over at County Behavioral Health, Monica Kurz over at KSBHQ, Tony Foster over at Emergency Communications, and Stephen O'Neill and the other wonderful folks over at Burt Nash. So thank you all so much for the opportunity to both present to you and to be collaborating with you.
So we will stand for questions if there are any. Like I said, in both cases with the Familiar Faces Initiative and with this work, we're kind of just getting started, but it's important system work. It's the type of work that this season requires so that we make sure that the investments that have been made in behavioral health yield the best results for the people who need the services. And we will be happy to come back with more details once we have worked through the process of our first set of deliverables. Questions?
I want to thank our guests for acknowledging the great work that some of our partner organizations have done in collaborating and getting us to this stage. I'm really excited for kind of the next step of excellence that we will get to with your help. So I appreciate you being engaged with us and giving us the opportunity.
I don't have any questions. It's a great job. Okay, well, this is a regular agenda item. Commissioner Reed, did you have a question? Okay, this is a regular agenda item. We'll open it up for public comment. Okay, since there's no public comment, we'll bring it back up to the commission for any comments.
This is Commissioner Reed. I just wanted to also extend my gratitude and very excited to hear about this opportunity and the technical assistance that our county and city will be getting. And that's just something that I maybe geek out about a little bit anyway, but really think that applied research and technical assistance work is something that our community has been very smart about leveraging and getting expertise and outside perspective in the context of, you know, our whole country and our community in relationship to other communities. And I think that's really, really valuable perspective for us to be having and balancing with what we sort of intimately know and believe about our community. So I'm just very excited for this opportunity. And Bob, the behavioral health report looks really great. And I love the format that it's in, and it's super accessible and digestible for people to go poke around. So really excited to be sharing that with folks and see the final product. And you know, something that's been important to me throughout this, the Familiar Faces initiative, the sort of the leadership initiative that happened in the last year with NACO, was that as we talked about MyRC in implementation in Douglas County in particular, and how to keep maturing the use of that, something that's really important to me is that we keep focusing on how it is mutually beneficial, right? How it is creating more streamlined work and more clear pathways for service providers to connect their clients to resources that are valuable and to be able to have real-time useful while still, you know, sensitive information available to them. I think there are a lot of technical solutions that we can resolve in order to make this a tool that is both useful to the community members that we're trying to serve and fail less, as well as service providers who will have more efficient and streamlined and predictable ways of communicating with each other and sharing. So I'm looking forward to seeing what comes next.
I just want to thank Chief Lockhart for responding to the grant and thinking and really, you know, it says something that, you know, those partners that you work with on a regular basis and have already developed those relationships with, that you can call on them quickly and clearly. Our new partners at the Harvard Government Lab, they've recognized that as well. And I think it really speaks highly to what we've been able to accomplish here in Lawrence Douglas County by partnering together. So thank you for that. I'm sure that you will be called on to serve other communities in the future once you go through this process, and it'll be great to share our story elsewhere. And Bob, I want to say how much I appreciate that website. It is really helpful. It is really easy. what you shared tonight is really easy to navigate in chunks that the community would expect to understand how their investments are paying off. I'll be excited to see, you know me, I geek out on the data there and see, you know, the impacts that these dollars are making. So thanks for sticking with that and keeping communication with our community at the forefront of your thought.
I'm excited for the learning process and for having colleagues in that with the other communities that are going through this at the same time. I'm also really excited to see what the deliverables will be and what kind of outcomes and measures we can collect from this initiative and message back to the community about why these services matter, why these dollars matter, and the impact that they have for our community. So thank you.
Okay, thank you all for being here. We'll move on to our next item, which is a request for one-time funds from the behavioral health sales tax for purchase of land for permanent supportive housing by Burt Nash Community Mental Health Center in the amount of $427,000.
Commissioners, I'll just say a few things as Patrick Schmidt comes to the podium. Patrick Schmidt submitted this request to us and we wanted to get it before the commission in September. So you have information in your packet related to the project, and you heard about this at our budget request. And I'll turn it over to you, Patrick.
Thank you, Sarah, and thank you, commissioners, for the opportunity to come and present. And both Matthew and Stephen are here in the event there's some very specific questions that they are better able to answer. So I may call them up. But this is connected to the earlier request that you looked through and provided support for in the 2024 budget. Or the permanent supportive housing project number 1. I think there's a different title for it. The Burt Nash Douglas County Behavioral Health Tax Proposal 2023 Supportive and Rehabilitative Permanent Housing, the SRPH Project 1. So this is connected to that. In that report, we had a rough timeline, but you never know when you're talking about purchasing a land. Commercial real estate can either move really slow or really fast. In this case, parts of it moved slow. Because we had sent requests and didn't hear back. We tried a different approach and all of a sudden it moved forward and moved forward fairly quickly. And so we are in a position now to be able to move forward with purchasing the selected site for this project and would hope to be able to close on it by the end of this month. And so that support in the amount of $427,000 would allow for us to complete the transaction. As you see in the request, we have a large amount of funding through 2 sources at the city, as well as through the state of Kansas. And so this would be one piece of some braided funding to support us moving this project forward sooner rather than later. As we listened through the 4 o'clock study session, the need for this type of housing is critical, and we have an opportunity to move forward a portion of it now. Will it solve everything? No, but we have to get started somewhere. And as Bob referenced earlier, we've started. Here's another opportunity to move forward. As we have said, or as you can read in the proposal, the project would allow for 24 units of permanent supportive housing in the addition to some commercial space. When we say commercial space, it would be utilized by Burt Nash for housing our staff. Many of them would be community-based staff and staff available to help support individuals in the community. It would allow for us to do some expansion of staff and space to put them in there. So not only is it an opportunity to provide and make a space and an impact on the housing shortage specific to the individuals we work with, it allows for us for some growth into the future. This is one-time funding that we are requesting in terms of the development, because once it is developed, it has a sustainable funding model attached to it, in part with rent received through the vouchers, as well as through the CCBHC funding for services and other funding sources. So with that, I'll stand for some questions.
Patrick, can you remind me, what was the grant opportunity or the funding opportunity that fell through that left this funding gap? Because wasn't there was a plan for that, and that's why we were approached for just hard construction costs through the budget process. Can you talk about what was planned for that and what maybe changed?
Matthew, you can talk through some of those. I will say one of the funding mechanisms we were going to utilize was, as we had talked to Sarah earlier this spring, with the idea of selling 911 Ohio, which is a property we own that had just 2 units of permanent supportive housing, and on the lower level it had our crisis apartment. Well, once the TRC opened, we knew we were not going to need the crisis piece of it, and to prepare and to really remodel 911 Ohio successfully to change it was going to be cost prohibitive. And then unfortunately, it caught on fire. And so before that, we had planned on selling it and using some of the proceeds for this. Then it caught on fire, and we are still in the mitigation process of trying to get that prepared. So the timing of being able to sell that and use some of the proceeds for that just don't exist. So, Matthew.
Thank you, Matthew Falk, Director of Housing with Bert Nash. We had been pursuing some state grants, for example, the Sparks grant, which were allocated to other programs. So those pursuits did not come to fruition. We are continuing to pursue other funding. We're partnering with the county on the State Home app, along with the other partners of that process. We have had some discussions with some foundations in the region. They do expect us to approach them. There's some time in relation to those strategies. We want to have as much as we can in the bank before we approach some of those foundations, because they will base their award on what we have to date as a percentage of the overall project. So again, there's a lot of timing that's involved with this project and what we're trying to achieve. So hope that answers your question.
Matthew, since I think you're probably who can answer this best, is it fair to say that there are fewer available grants or foundations for land purchase, these capital costs versus the sort of future development cost and cost of services that are going to be associated with it? Is it fair to say that there are fewer options available to seek funding for just the purchase, this first phase of purchasing the land, than there will be for opportunities for what your future plans are?
Yeah, typically the funding streams that exist traditionally don't all, allow for purchasing. So for example, I believe, home funds would not always fit within a purchasing process. Sometimes they do, sometimes they don't. And depending on the, they're, for example, ESG funds, emergency solution funds, sometimes they can be used for those processes, sometimes they can't. They're not available at this time. So yeah, it's not that it can't be done, it's that they're not always set up to do that at that time. So yes, I would say yes, that is true. And we're in a period in which, as a community, we had a large amount of funding with COVID, and those dollars are drying up. So I think that itself is a larger issue that we'll need to address as a community. And as we try to move forward with the initiatives that we're seeking to reduce a lot of the challenges we face locally. So that's, at least for the last 3 years, that's probably the biggest challenge that we face right now, is that some dollars that we would have liked to have gone after, timing wise, it didn't line up. Those dollars have also now been depleted. So sometimes you're in the right place at the right time, sometimes you're not.
So I just have some questions on timing here to make sure I'm clear on the request. So in our budget process, we approved for this project $2 million in cost for construction. Is that correct? Right.
I'd look to Sarah to know the exact language
Okay.
in that.
And so this is in addition to that $2 million. You're asking for another $500,000 for this project?
I am actually not going to presume which direction you want to go with that, whether you, because it's your money. I'm not going to say I'm asking for 427,000 more. If what you say is we've allocated 2 million for that and we want to take some of that for this piece of it, that's completely up to you. If you want to add 427 to the total, that is also up to you. But it's your money. I wouldn't presume
Okay.
what you should.
I
do
just
with it.
wanted to be clear if this was another request. Because you said it was related to the earlier request, so I was trying to be clear.
It's related to the project that
Okay.
request. So
Okay.
thank you for that opportunity to clarify that.
Okay, so that gives some options to the board as how they want to move forward on that. Okay. If the board doesn't approve this evening, or how would you meet the gap if we don't approve this? Would you use the 2 million? Would you look to other funding sources? Would you look for another site? What would be your next steps?
I guess our first thing is we would, and not that we haven't, Mike, as our finance director, has already been exploring other options should this not go through. We've talked to 3 different banks and that. So that might be a thing we would have to do. We might have to seek a delay on the closing so that we could secure the funds through other means. You know, if you say that it's not available from the 2 million, that's what we'd have to do. We'd have to find another way to close this gap in order to be able to secure the building or the site. Would we look at a different site? Yes, but the identification of this site was how many years in the process? About three years, yeah. And so it could potentially, if we had to go find another site, it could potentially delay. I think when we think about this site, it is well located for access to food and other services, bus lines. It's also centrally located in town for the individuals who live there, but also the people that would work in that building, be able to move about easily to get out in the community and serve individuals. So.
We got some communication from the community about the site that maybe doesn't agree with you, and that isn't very moving to me, but I would be interested in hearing what other sites that you explored and turned down for this site, which you prefer.
Sure, I'll actually let Matthew talk about some of the sites he's looked at. So, thank you.
Well, as you all remember, we did start with the city looking at a site downtown, and I won't rehash what happened there. We did move to a site in East Lawrence, and for all intents and purposes, that looked like it was going to move along, but the individual who was the proprietor of that site was not willing to sell it. They wanted to enter into a 100-year land lease and retain us as tenants. So we did a wider search through actually every parcel of property that the city owns as a wider sweep of any kind of donation that they could go through. Have continued to look at commercial sites throughout the community. Zoning is an issue. You know, ideally, we wouldn't want to have to rezone the site. This site is zoned in the correct zoning. There's mitigation on a lot of sites, existing buildings, things that might we would either tear down. The site's not large enough, for example, for us to build the size of project we're trying to build and also meet the other requirements like parking, the other types of development requirements that we would be asked to meet within those areas. So after that kind of process, I guess what I would say is of all the property that is available, this is the most ideal for us. That being said, life goes on, right? So I guess second what Patrick said, in the sense that there are some qualities to this site beyond not only its location, but its size, its dimensions, it's relatively flat, right? Won't probably take a lot to develop it. It already had a big commercial project on it, a hotel, right? So there's some infrastructure that already exists. There's some other things involved with this site that are a positive for us in this project, so.
One more question. When you take the number of units that are here and the total budget cost, it's pretty high. Any thoughts about that? Anything you want to share about that?
Yeah, I can. That's part and parcel because we're also adding in staff space on the ground floor. The actual cost per unit for the unit is around it's around $200,000 per the unit as a new build. When you just separate that out, our initial, I guess, cost projection with our design team, separates that out. So you can look at the difference between the residential component and the commercial component, and then look at the cost per unit from that perspective as well. Right, when you look at the whole project, it's quite expensive for 24 units. We're also getting a lot more capacity from a service standpoint because we're adding that office space, which is the equivalent size of the residential. To stay within commercial strip zoning, the residential component can't exceed 50% of your gross square footage. So the office space would need to be the same size or larger than the residential component. We've designed it to be the exact same size to maximize the residential component of the project.
How many employees will you have there?
Just off the top of my head, that's 60 plus. It would be all of our community-based teams. So all of our community-based case management teams, which includes our ACT team, the Served Community Treatment team, a strengths-based case management team, our peer support team, our dual diagnosis team, the supported employment team, the homeless outreach team, the behavioral health court team. All of those teams will fit into that space easily, plus some other staff that
And where are those staff now?
Right now, we're all shoehorned into the medical arts building that Nash is leasing. So this project would also allow us to get out from under a lease.
Just have you say that again. So you would no longer be leasing the space at the medical arts building once this building comes online. This would be an owned property as opposed to a leased space. Thanks.
So I guess that begs the question of what's your lease, I mean, can you use your lease payment to help pay for this additional cost here? Is that something you've thought about? I mean, if you're no longer leasing that space.
That would be a component of the long-term sustainability for that portion of the building, yes.
Okay. Any further questions, commissioners?
Can you clarify for me and so that I don't scroll trying to find it in the packet, what cash from Burt Nash reserves or Burt Nash Foundation have, if any, have been infused into the purchase of the property? So we talked about the City of Lawrence funds, money from the state, or have there been any funds applied from Burt Nash reserves or foundation?
No.
Okay. Is there a reason? Do you want to expound on that at all? I mean, are
Burt Nash
those
does not-
investments planned for the future of the project?
Nash would be long-term, having some money into that. Our foundation is in many respects a true foundation where we pull off a certain percentage every year to help us with the operations. It is not typically used as an account where we get to pull from as we need to. Now, we did pull some from that in order to help us move forward with the CCBHC. But that is in the form of a loan that we will be paying back over the next year to year and a half timeframe. Outside of that, the reserves, we don't have reserves to just drop into this project at this point, though I know that in the future, again, are along the lines of instead of a rent payment, instead we'll be using some of those funds to help pay for those things. Again, more and more of the staff that will be in that building will also currently are on our cost report. for our CCBHC. And so some of the funds that support that will also continue to flow into that space to help us with that. So, and that doesn't mean that when we get further down the line and we know that we need to close the gap, that we won't be part of closing that gap with some reserve fund that we have at that point.
You mentioned CCBHC. Is capital cost something that you can include in your CCBHC rate?
I'm gonna let Stephen, our CCBHC cost report person, talk on that piece of it.
Hello, Commissioners. Stephen O'Neill, Chief Operating Officer. Capital expense is not an eligible cost. Mortgage interest is, rent is, so there are ways in which the project will be supported with CCBHC. But if you look at this project in the context of the whole system, you know, Burt Nash has grown significantly, and we've brought in this year alone $11 million more in Medicaid revenue than we have historically. And that's $11 million that's creating jobs, that's creating additional services for the community. So I think for me, this project, and I'm expanding on the answer to your question, if viewed in the context of the whole system, it does allow us to house that expansion that's been necessary to meet an increasing need. And the jobs there, the 60 people that will work there, those are good jobs. So I think that's another kind of benefit of this as well. But no, the capital expense is not, for the land purchase, would not be eligible.
Any further questions, commissioners? Nope. Thank you. It's a regular agenda item. We'll open it up for public comment. Would anybody like to provide public comment on this item?
Erica Anderson again. Thank you for all the information that was provided. It actually, a couple of thoughts came to mind. First off, as we look at braided funding opportunities and collaborations, we have many payers that are working in this space around social health, but around mental health, but are also around homelessness. And as I heard the gentleman speak about the 60 individuals that will actually be housed to work in this space, it really sounded a lot like healthcare implementation to some degree, as well as social health, but also mental health. And so I'm wondering if there's an opportunity for Burt Nash to partner with payers to collaborate within this space for these funding opportunities, especially when it comes to the capital investments. They are able to fund in those areas. So there was a mention of the Medicaid revenue that's been coming in. So we know that there are several payers that are working in Kansas in this space. And so I would encourage Burt Nash and many of the others that are working on this to approach those that they're actually seeking those reimbursements from, to ask them to collaborate on this work, whether it be Blue Cross of Kansas, Blue Cross of KC, Aetna, Humana, United Healthcare. All of them have significant initiatives in these areas and buckets of money to fund this type of work. And I know it's probably not going to meet the guideline of the next 20 some days to close on this, but it might at least help with some of the budget constraints moving forward and bring in other partners that have some of this technical assistance, but at the same time, leverage a lot of different opportunities to bring other experts to the table, but also funding opportunities to move this work forward. So, and I would also encourage the case management piece that we brought up earlier for the housing initiative too, to ensure that maybe that's a component of the 60 individuals that might be housed there as well. So thank you.
Any other public comment?
My My name is Gene Dorsey. I live at 2038 Emerald Drive in Lawrence. I'm here speaking as a private citizen and not with any affiliation of any group I might have. I recommend you approve this project. It's a good use of the $16 million that you have sitting in a bank account with dust growing on it. So I fully support this. Part of it's a personal reason. If my son were alive, he would be probably a candidate to live in this type of long-term housing. And I know there are other people out there like him that could use it. Thank you.
Any other public comment? Anyone online, Sarah? Okay, we'll close public comment, bring it back to the commission for discussion and or motions.
So commissioners, we got to talk about this during our regular budget process and had the request. And one of the things I liked about it was the kind of deeply braided funding model that was brought to us, and also kind of a stable long-term funding model with the rent income from vouchers and such that would help cover the costs long-term. I do recognize that it is harder to come up with funds for land purchases as it is for kind of hard construction costs, which is what we had earmarked our funding for based on the request that was given to us. But there are a lot of funding opportunities and foundations that like to give to one-time projects and capital costs for something just like this. So I think that as the team has already identified many of them and will continue to identify more, that those pieces will fall into place. I do not mind freeing up a portion of the monies that we were allocating already from our budget from one-time costs from the behavioral health sales tax to allow the flexibility to use for this, filling this gap. I'm not interested in additional dollars at this time. We did turn down other capital requests that didn't have a significant amount of braided funding in them. So I'm comfortable with the amount we set aside. I'm not interested in adding to that at this time, but I think the flexibility, it sounds like, would solve the concern for the moment.
I agree. I think the 427 can come from the 2 million that we've already allocated for this project. I do want to address some of the, we got some public communication, and some of it's in our packet about the location of this. I can understand. I mean, I was going to say I understand, but I don't really understand. Like, we need supportive housing all across our community. It is not best practice to focus it all in one space. We've said that a lot. We've said it multiple times. We've presented that information, and we still get members of our community who see providing supportive services for those who are housed as a threat to their neighborhood. I don't buy that. I think we need to have them all over our community. There is probably someone with a mental health issue living next door to you right now, or at least on your block. And I think it's really important to recognize that we all have a role to play in our community on addressing that. We need more supportive housing. We have a needs assessment that addresses it. I think this property actually is pretty well fit for what we're looking at here. The access to transportation, I think, is key. There is a small apartment complex just north of the site that they're looking at, and this site has been vacant for quite a bit of time. So I'm supportive of the project and the location. I just want to make sure that we follow our funding process. I'm a little worried about continual asks to the behavioral sales tax fund outside of our normal budget process. I want to encourage our partners at Burt Nash to look for funding sources to this gap. This is nice that we're able to access this behavioral health sales tax fund, but I think we need to think about long-term. If I have somebody on my team come to me and ask me for more budget dollars, my request is usually where are we going to take it from, not let me go get you some more money. And so I think that's just something to think about. But I'm comfortable taking it out of what we've already allocated.
So, Mr. Chair, I know this is a bit of a side note, but I do look at other counties and how they allocate not only budget dollars for outside agencies, but also specific sales tax dollars that are bound by the letter of how those sales taxes were passed. Some of them do have more of a kind of semi-grant funding model. I think that is something just to talk about in the future. I've not necessarily wanted to go to that method for our partners that apply during our grant cycle, but especially anything outside of that timeframe, like being able to articulate, these are the kinds of funding parameters we're looking for. These are the kinds of things that fall within the language of the sales tax, could be helpful for us to communicate to partners and for them to kind of fall in line. So they're bringing us requests that already fit. So that's not today's issue. And I didn't discuss the location at all, since that's not kind of under our purview. We did get communications about that. I think communicating to the public that that Bert Nash meetings are also entirely open to the public and take public comment. So that's correct, right? And that is a place where those questions can be more fully answered and those conversations can be had about why this location, like that's not something that we participated in. But I think I appreciate you asking for some of that clarification, because I think folks do want to know, like, what else was considered, and the appropriate place to get that information would be directly from the Bert Nash board, which is an entirely appropriate place for people to send that communication.
Yeah, well, one note about the location that I'll just add on is that I will say I was disappointed when the East Lawrence location did not come to fruition, because that on the surface that seemed like a pretty good fit. But I can also see now that there are more benefits to this current location for many of the reasons that you described, Matthew. You know, in terms of not having to rezone, the accessibility to multiple bus lines, and sort of it's just a much more accessible location for many of the reasons Commissioner Kelly just mentioned. So I do think, but that's my opinion. And I know that Bert Nash has been on a long journey to find a spot and find something that checks a lot of sometimes competing, boxes and values. But so I'm excited for you all that that there's a tangible location that really checks those boxes, and I'm supportive of the project. As my it sounds like both my fellow commissioners are interested in making this request work within the bounds of the 2 million that we already allocated. I think that my question for Sarah is, help me understand the timing of that, because to me, like my understanding of receiving this request now is because of the sort of time crunch. One, that maybe and maybe I misunderstood earlier, or it wasn't said explicitly, that this particular funding gap was not known particularly at the time that the 2 million request came to us for the budget process earlier this year. And now there is this sort of time constraint that exists. And so that the request is coming to us as separate from that process, because it was unknown a couple of months ago, and because there's this time constraint. And if we were to take it from the 2 million that's allocated, how does the timeline work with that, since those are 2024 dollars that have been allocated? That was long-winded, but did that land?
I think I can get part of the way, and then let me know if I missed the mark. So the commissioners are right. As a general rule, we don't accept ongoing requests for ongoing resources outside of the budget process. This is a one-time request for one-time capital dollars. We have on rare occasion, I like to say that, rare occasion, accepted those requests outside of the budget process. Generally, we like them all together, because ultimately county commission can weigh all kinds of factors at that one time when making those decisions. In this situation, these were allocated out of 2024 reserve funds. The reserve funds are available today to make this part of the request. We will be off on our beginning fund balances and ending fund balances, but you know, we can accommodate that. That's not a budget issue or an audit issue necessarily. So, you know, what I would recommend is if the commission wants to proceed, that we would release $427,000 of the funds in 2023, and then the remainder of the funds could be available in 2024. Because they're coming from one-time dollars since I think it'll, and we have sufficient funds available to cover it.
That helps. Thank you. And then I guess I'll also say, I mean, I agree that we have to keep some containment on requests outside of our budget review process that is annual. However, in particular with the behavioral health sales tax funds, it feels like that there's a degree of flexibility that is necessary for us to really leverage those dollars when opportunities present themselves. And so, again, I know that's not what we're resolving tonight, but I, you know, just want us to keep that in mind in future conversations if we try and develop some, you know, parameters or processes specific to these sales tax dollars, which are different than property tax dollars in the way that we allocate those for general funding. I just want us to be mindful that some flexibility still feels necessary for our community partners and to be able to hop on opportunities when they present themselves and not miss them. And I trust that staff, that's part of their screening, right? And discretion about whether or not to bring these requests before us. So
I would say that if we hadn't allocated that large amount of money now, I would be more compelled to add this to it, right? To make that response, but we've already allocated that. I would be really surprised if they spend that entire amount in 24. I mean, you've got design work you've got to do, you've got bids you've got to do. I mean, I think we've set this aside for this project. What I want to be cautious of is, you know, all partners in this behavioral health space coming to the table and saying each year, these are the projects we would like to work on. I would assume Bert Nash may come back and say, we want 427,000 next year's budget cycle to cover the difference. I would want to see more braided funding, you know, that kind of thing. So I think in my mind, just as a point of clarity, when I thought about this request, if this was outside and this was a property and this was the right time to buy them, we hadn't allocated any dollars to this project, I would be more quick to spend it outside of that process.
that makes sense.
And I agree that there's more flexibility allowed through that sales tax because it's spelled out for what that can be spent for. I also, as I'm kind of formulating that in my mind, like the idea of some kind of a grant type format, because in part we can push that out to partners that don't yet engage in Douglas County and have them realize that there are funds available if they would like to do that work here. It might be a way to kind of capture the interest of some other organizations too, and just give some clarity so that as folks are coming for requests for those dollars, like they know what the expectations are.
Yeah, I think to Mr. Dorsey's point, and he's made it a few times here, I think we have to develop somewhat of a system that better articulates to our community partners how we're going to allocate that money, review these requests. This is a little different than our mill levies in that it's a sales tax fund. The city with their affordable housing and some of this funds that they have a grant process that they go to. There's problems with that as well. There's things I don't love about that, but for another meeting at another time, I think that would be good for us to discuss.
I know we're going to talk about this all again later. I just want to caution the commissioners too, we're really still in the formulative stages of how all of these funds are going to be used in the community. Some of the funds have already been allocated. There's a long anticipated project with DECA that was identified in the sales tax. Those funds are in this reserve. There is a lot planned for some of these dollars, and we still need capacity in this space to use these funds. They're actively being spent every day, and they're being used for the good of the community. They are not just sitting idle. So I wouldn't want to give the community that impression. And I do think it's important that we give ourselves capacity, that as we're learning more in this space, that we have funds available to do that. We don't know right now everything we need in this space. And so I just really ask the commissioners' patience as we continue to evolve through this process and continue to determine how best to use these funds. But we will need to keep a balance in here. There are bond proceeds out of this fund to pay for the debt for the TRC. So there will always be a balance in this fund to make sure that we can accommodate all those things that we've committed to.
And I do still highly value braided funding, when requests come to us, that they have also identified funding outside of Douglas County that will help with that process, because those funds are there. There are some really great projects and funders that would like to be a part of that. I don't want to ever feel like we have to carry the burden alone.
Thanks, Sarah. That's good advice. Commissioners always need to be told to be patient, so I appreciate that. I am going to go ahead and make a motion to approve. And Sarah, I could use some guidance on this. Is this a reallocation, the way that the motion is written here sounds like for additional funds. Is there a way we can?
I think if you add that you want it taken out of the $2 million allocated in 2024, but to $427,000 of that 2 million to be allocated in 2023 for land purchase, that will give us the clarity we're looking for.
Okay. So I'm going to make a motion. No, I'm not going to. I'm making a motion to approve the $427,000 of the 2024 budget allocation out of the behavioral sales tax to Burt Nash Community Mental Health for purchase of land for permanent supportive housing.
Second.
Moved and seconded. All those in favor say aye.
Aye.
Passes 3-0. Thank you to our partners for being here. We'll move on to a resolution expressing support for the Board of County Commissioners, Douglas County, to submit a pre-application for home ARP funding to the Kansas Housing Resources Corporation. Is this Jill?
Good evening, Commissioners. This request is for you to approve a required resolution. It's a required attachment as part of the Kansas Housing Resources Corporation's request for proposals for home ARP funds. Those are Home Investment Partnerships American Rescue Plan Act funds that have been awarded to the state of Kansas, and the RFP has been issued by KHRC, that's the Kansas Housing Resources Corporation. That RFP was released on July 5th. Shortly after that, a group of area agencies got together and began the development of a collaborative application that will be led by Douglas County. So Douglas County will be the lead applicant, and that included in the proposal will be a series of projects that are reflective of the eligible activities in the the qualified populations that are identified in the RFP. I gave you a snapshot of the eligible activities, the agencies, the eligible activities and the proposed projects in the briefing sheet. And I did add a statement in there regarding the fact that KHRC is not asked in the pre-application process for agencies to identify a funding request. Rather, they're going to come back to us if we are approved to advance to the official application. they will identify how much funding will be awarded for the proposed activities. We do have to provide some budget information in that, in terms of pro formas for any activities like Bert Nash's permanent supportive housing project. Super excited about that, but also some other activities for supportive housing and transitional housing with our different partners that are outlined here. So that's where we're at. We're on track to submit that application in time for the September 8th deadline. And it's been a really great project to work on with the different partners. And I'm happy to stand for any questions.
I don't have any questions, commissioners. No, okay. Regular agenda item, any public comment on this item? Anyone online? Okay, bring it back to commission. Comments, motions?
Very excited about this. And know that it has been a labor of love because it's a hell of a pre-application process. See if you can get your foot all the way in the door. So thanks for all your leadership on that, Jill, and thanks to all our partners because it is no small feat to get many organizations to think about pooling funding, asking for pooled funding, and then utilizing it accordingly. So I'm super hopeful about it and really excited and happy to make a motion if there are no other comments. I move to approve a resolution in support of Douglas County's pre-application submission to the Kansas Housing Resources Corporation for home ARP funding.
Again.
Moved and seconded. Any further discussion? All those in favor say aye.
Aye.
Passes 3-0.
Thank you, Jill.
Thank you, Jill. I know that's a lot of work. All right. It's time to move on to a special use permit from Eric Garrett. I don't know why I said Garnett. Of Garrett's Entertainment LLC, doing business at Garrett's Haunted Farm. And I'll let Carl go into the details of this one.
All right, good evening, commissioners. This is a special event permit for a Halloween themed event at 1387 East 1650 Road. So first, a little bit about special event permits. It's pretty uncommon that a special event permit comes before you. There was only one that was brought before you last year, and it was this one. So most special event permits that come to our office are approved administratively, but in the zoning code, there's a list of conditions that need to be met in order for it to be approved administratively. And some of those include event hours being between 8 and 11, lasting no more than 14 days, attendance under 100 people, making sure there are no overnight stays. And if it doesn't meet those conditions, it has to come before you for approval. And in the case of this special event permit, that's the case. So just running through this again, the property is located at 1387 East 1650 Road, also known as Franklin Road. This property is pretty unique as it's a county island, meaning it's an unincorporated piece of land that's completely surrounded by the city of Lawrence. The property is split zoned, with the northern part being zoned light industrial and the southern part being zoned transitional agriculture. The property is used as a rental home as well as agriculturally, with a seasonal fireworks stand on the property as well. Surrounding land uses include industrial, commercial retail, Tractor Supplies right by there, and residential. There's a city bus stop on the southeast corner of the property, and then immediately across the street to the southeast, you have the county jail, and further to the southeast, you have the Lawrence Community Shelter. The festival is set to run between September 27th and Halloween. The festival consists of two parts. a children's event during the day, and a zombie paintball hunt at night. The children's part runs from 9 in the morning to 6 at night. It includes a corn pool, slide, bounce houses, a train ride, which is really a diesel tractor, along with some other activities. There's also a tent on the site that includes some retail sales, and there may be some outdoor food vendors. The zombie paintball portion of the event operates Thursday, Friday, and Saturday evenings, plus the days leading up to Halloween from 6:30 to 11 p.m. It consists of a group of customers riding on a trailer attached to a tractor, and they're pulled to different scenes around the property, and they shoot paintballs at actors dressed as zombies. And the applicant has said he intends to hire about 12 to 15 actors to be those zombies getting shot with paintballs. The zombie paintball has a ghost town theme, as this is located near the site of Franklin, Kansas, which was a community that was active around the Bleeding Kansas period. This is the applicant's site plan showing where those various scenes are located. There's parking north of the existing residence, and the tent is also located on the northern part of the property. So with that, staff is recommending approval with the same conditions as last year, with one exception. Last year, there was a recommended condition that required the hours of operation to end at 10 p.m. We didn't receive any complaints during the event last year, so we're willing to allow this to go until 11 p.m. as requested. With that, I'm available for any questions.
Thank you, Carl. I don't think I have any. So it's 11 p.m. I think in the staff report, it said 11:30 p.m.
And I would ask the applicant to correct me there. Is it 11 or 11:30?
You'll have to come up to the microphone.
Good evening. I'm Eric Garrett. Honestly, last year 10 o'clock was fine, but we have cleanup, so 11 o'clock would work.
Thank you.
Gotta stay here just in case.
Sure.
Thank you.
Any other questions for Carl? And then we'll give a chance for the applicant to speak. Okay. You're welcome to share any information you have.
Last year it went pretty well. And it was, I think, a lot quieter than people imagined it would be. And I'd say it pretty much went off without a hitch, and it was as planned. So that's all I have to say.
Questions for the applicant?
Yeah, just a clarifying question. So your intent is still to hours of operation will be until 10, like no more public public will be exiting by 10, and that extra hour is really for cleanup buffer, because that was part of my thought, is if you have public there until 11, how late would you be there
Right.
cleaning up every night?
What we found last year was that there was a big drop at 10 o'clock, and there wasn't a lot of interest after that. But I've talked to other people who do this, and they say that as it gets more popular, that we will probably fill that later. So I'd like to reserve the right to do it by 11, but I don't think we will. It just gives us, a chance to finish up everything and do it right without being in a hurry.
Your questions for the applicant? Thank you, Eric.
Thank you.
This is a regular agenda item. We'll open it up for public comment. Anyone like to provide public comment on this one? Anyone online? All right. Bring it back up to the commission for conversation. Motion.
Commissioners, I have to admit, I have struggled with this application more than most that we see in terms of kind of divorcing my personal opinions on some strongly held kind of ethical beliefs around guns, and the fact that it meets all of the qualifications that are allowed and asked for in an application like this. I've decided that is, even though I am a gun owner and occasional hunter, I feed my family that way occasionally. And because of that, we have just very, very strong feelings about gun safety in terms of there are no toy guns in my world. We never point a gun at anyone, not even a water gun, not a Nerf gun, not a paintball, and pull a trigger. It's just, that's the part that I've struggled with this. I recognize that I've also, even though I've not participated in those activities or allowed my family to, have never asked a business not to hold those activities because of my feelings about it. So I will vote in favor of this. All the other aspects of the business are great and glad to have, activities for people to do. That's been my difficulty with it, and including a conversation with our legal counsel to kind of help ferret out what my options were with that. But thanks for hearing me out.
This is Commissioner Reed. I appreciate that, and Commissioner Willie, I really do. And I feel the same way that you do in terms that it cannot be taken lightly that guns are not toys. And so I appreciate that challenge. I wonder if the applicant might be willing to just come up and humor us for a moment and talk about, like, is there any information that you talk about in terms of, well, I'd be curious just on a purely paintball only, logistics, what does conversation about safety look like for people who are participating in the paintball zombie hunt portion of things, who are being given weapons to use in this activity? What does safety conversations look like?
So prior to doing anything, they are given a safety briefing. There are caps that go over the guns, kind of like a bag on the end, and they're not to remove that until we go to the practice zone. Once we go to the practice zone, they're taught about the safety on the gun, what's live, what's not, how to fire it, and they're given strict provisions about what to fire upon.
Thank you. That's helpful for me. I mean, I just want to take the opportunity to, I think that we can always incorporate more conversations about that, right? Like about responsible gun ownership and use. And I know we're not dealing with real guns here. And also still they look and feel and act like a gun that would have ammo in it does. So I think those safety conversations are not to be taken lightly. And I appreciate you taking time to bring it up, Commissioner Willie.
Problem.
Eric, before you leave, I'm just curious, is there an age limit on the paintball experience? Or
we had considered that, but I think it was like if they were under 6 years old, they had to be with a parent, like in the same seat. So the parent would kind of hold them. It was more for them because the kids have to stand up when they're little.
Thanks.
There's probably people out there that would argue that allowing people to do something like this maybe has a better effect, that they're able to get their aggressions out on actors with harmless guns instead of doing something in real life.
Possibly. I want to be careful on a land use application of getting too deep into the weeds of that. But I mean, I appreciate Commissioner Willie's comments, and I think we all share concern about safe gun use. We have a gun epidemic in this country, and I think there's a lot we could unpack around that. But this is a land use application, and that's where our focus should be. So I'll make a motion to approve a special event permit request from Eric Garrett to allow an outdoor Halloween themed festival to operate daily and a zombie paintball hunt to operate Thursday, Friday, and Saturday evenings between September 27th and October 31st on property located at 1387 East 1650 Road with the conditions listed in the staff memo.
Second.
Moved and seconded. All those in favor say aye.
Aye.
Thank you.
Thank you.
Carl, before we leave this item, I do want to thank you for the YouTube links that were included in the staff report. That's not something we usually get, and I was very entertained by the Philadelphia Eagles and that background. So thank you for that. All right.
Thank the applicant for providing those.
Yeah, those were not our typical board packet, I will tell you that. We'll move on to a temporary business use permit for Dennis A. Thorne to allow continuance of outdoor vehicle storage and remediation at 1036 East 1000 Road.
This is related to another application that you saw last year. This is a temporary business use permit from Dennis Tomey to allow him to continue storing and removing vehicles on his property located at 1036 East 1000 Road. The applicant owns the property along with his sister, and the property has been in his family for over a century. It's zoned as agricultural. The vehicle storage there is not a permitted use, but the property has been used for vehicle storage for decades, and those vehicles had accumulated little by little over the years. There were approximately 20 vehicles in 2001, and last year there were approximately 100 on the property. A temporary business use was approved last August for a one-year period, and there was a requirement attached to that progress must be shown in removing vehicles. And so far, 35 of those vehicles have been removed. I've been out to the property and can confirm that many of those vehicles have indeed been removed. The applicant is the owner of Cardinal Motors, which is an automotive wholesale business. He stated that those vehicles on the property are an investment and that most are operable or nearly operable. Our office had received complaints in the past and has been addressing this issue since at least 2001. And as mentioned last year, we're trying to take a new approach with this property, trying to be less heavy-handed and allow this permitting path instead. So the applicant stated last year that he intends to remove all of the vehicles within a 5-year period, and he also agreed not to bring any new ones, and no new structures are being proposed with this request. So again, location, this is located southeast of Lawrence. Here's an aerial image of the property. You can see a branch of Washington Creek runs through it. Much of the property is in the floodplain, and we wanted the applicant to focus on removing vehicles from the floodplain first. And I can report that most of those vehicles that are in the floodplain have been removed. Most of the vehicles on the property are located closer to the road, up by the house, up by the barn. And then here's some aerial images over time showing the increase in vehicles over time. Unfortunately, we don't have a new aerial image showing that those vehicles have been removed. And then some additional aerial images showing the vehicles on the property. So with that, staff is recommending approval with the same conditions as last year. I did make a small typo in the staff report with this condition right here. So instead that should say prioritized. And with that, I'm available for any questions.
Thank you, Carl. Any questions? Okay. Applicant is here. You can provide us any comments. You don't have to. We may have some questions.
Commissioners, my name is Dennis Tomey, and I'm open to any questions you may have.
Any questions? Okay, super. Thank you.
Thank you.
Is there anyone here who'd like to provide general public comment on this? Not general public comment on this? Okay, and no one online, Sarah? Okay, we'll close public comment. Carl, one question that just came up, but have you had any complaints? I mean, is this a new process? Have complaints gone down to this property as people have seen work being done?
I'm not aware of any complaints coming in since last year.
So commissioners, I would remind you, like last week, we did hear a complaint from this general area speaking about storage of vehicles. I think I have that name from my notes from last week, if you'd like me to get that to you, just to follow up, because I think it sounds like tremendous work has happened in addressing issues and maybe faster than was anticipated. It just would be nice to get a chance to follow up with a neighbor that had expressed a concern because it came through the public meeting last week. I believe it was a Mr. Johanning, but I'll have to check my notes.
I remember that and I can look into that further.
Dennis, I want to thank you for coming and for your continual work on this. This is a new approach for us. I know it's probably a lot of work for you. And we appreciate you getting your property into compliance with this. With that, I'll move to approve a temporary business use permit to allow the continuance of outdoor vehicle storage and the remediation thereof on property located at 1036 East 1000 Road, Lawrence, Kansas, for a 1-year period from September 6, 2023 to September 6, 2024, with the conditions as listed in the staff memo.
Second.
Moved and seconded. Any further discussion? All those in favor say aye.
Aye.
Passes 3-0.
Thank you.
All right, that ends our regular agenda. We'll move on to appointments. We took care of a bunch of those last week. I don't have on my notes that we have any this week, but I could be wrong, Sarah.
I will check. Did we make the reappointment to BZA last week? We did. Got it. Okay. That was the only one I had outstanding.
All right. Commissioner or Administrator miscellaneous. We'll start with Sarah's memo.
Commissioners, my memo is updated in the packet. I want to note that we do have a work session next week. Still have some work sessions in flux in the next couple of weeks, so I'll just try to keep you updated on that. And other than that, I stand for any questions you might have.
I would add that we did get an invitation, all of us just up here for the 988 breakfast, which is this Friday. I will probably attend. Don't know if others plan to also.
Yeah, I have that on my calendar, so I want to make sure Robin gets public notice for it.
Thank you.
I will be out of town, but thank you for the invitation, Steve.
I'm also planning to attend the recovery walk on Sunday. I didn't know you'll be out of town, Commissioner Kelly, Commissioner Willie. I didn't know if that was on your calendar or not.
That one I don't have. The Sunrise Open House is one I hope to get to.
Okay, great.
I will be joining you all by Zoom next week, so Commissioner Willie will be chairing that meeting from a distance. Thank you for doing that, Commissioner Willie. I did meet with the Heartland Workforce Investment Board today. Just so our commissioners know, we did approve a new agreement for the elected officials part of the board. The current agreement does not allow us to meet on Zoom. We've been doing that for quite some time and voting by Zoom. So the new agreement does do that. Something for us to just consider. I appreciate serving on that board, but as I read through it does not require the chair or a board member to be on that. We can appoint anybody to that, but it is an elected officials board. One of the things they are working on changing the bylaws on are around some committee work. It doesn't really allow for committee work, and they're going to change the bylaws. And that's partially because I've been meeting with some groups here in town. I think commissioners are aware of talking about how we build our workforce for helping seniors. So you're thinking about certified nurse aides, home health aides, things like that. And, the HWI only has a staff of 4. So some of these bigger initiatives of how we improve workforce, we're going to need to bring in some outside groups to do some of that work. And that's going to require a change to our minutes, to our bylaws. So I just want commissioners, since that's something that we're in that region too, with 17 other counties in the city of Topeka, for WIOA funds, that will probably be changing over the next, I would bet, at our next meeting. Any other miscellaneous items, commissioners? Okay, we're adjourned.